Good.
You're a little on the quieter side today.
We'll sleep.
Are you still waking up, or
Yeah.
how's their good weekend? Did we do anything fun?
Went to the Clemson game.
Ooh,
That's fun.
Yeah.
Stomped out state.
that was a good one.
Yeah. Yeah. They did.
How you guys feeling about studying?
It's a lot of studying.
It's a lot of studying. Anything else? Nothing? No thoughts?
Well, if you have any tips on how to study for pathology, that would be awesome. It's just so much material.
It's a lot of material. It's a lot of material, and the more time you spend with it, the better off you're going to be. But it's also going to be very individual. Like how each person studies is going to be different, and what works for one person is not going to be what works for another. You know, like we talked about in orientation on the first day. So if you're more an auditory learner, just like repetitively listening to the lectures over and over, versus me, like I'm somebody that has to read the textbook and rewrite every single thing. A lot of it is just pure memorization. So making Quizlets, making flashcards, those types of things can be helpful as well. But again, it is a very large, massive material. So try not to spend, you know, all of your time and energy into creating materials to study and then not actually having time to study it as well. So it's going to take some time, but you're going to have to find a little bit of a balance. But it's a ton of content, and I do recognize that. So in terms of like your quiz questions and test questions and things like that, I am going to try to pull out like your big concepts and not get, you know, bogged down on all the really tiny details. So just try to make sure you understand, you know, the big picture things, what's really important for us as PTAs, and try to pull that material out of it as well.
You've been watching a lot of like animated videos from pathology too, just like, I mean, not comical, because pathology can get real dark real quick. But like, there are a few that are, it puts it in a funny perspective, and obviously the animation of it helps you like, they don't do it. I've got a couple of them, like, we were taking biology, they were talking about, is what we're gonna go through today, like different white blood cells, the B cells, and it pretty much put it in an inscrutable door that goes on with your body, because there's a lot that goes on inside your body, and it is a literal door when something invades it, and it put it in that perspective, and the whole, it was like a 10-minute video, and it was like, it's really informative, especially for this.
And it might be easier to remember things like that.
Yeah, the digest.
When you have that visual association with that. Because right now, like especially today, guys, we have 100 slides to go through today, and it is just a lot of words. Okay, so I expect there to be blank faces, and that's okay. Like I completely it was hard just making this lecture, so I know that it's going to be difficult for you guys. So we're just going to get through it. Because there's so much content, we don't have as much time to be as interactive with it this week. So we'll kind of take breaks as we need to. We'll break for each chapter, break to discuss things a couple times. But for the most part, we're just going to power through. So buckle up. I encourage you to take notes, because I am going to say a lot that's not on the slides. And even if it's just mindless, you know, literally just typing what I'm saying, I would really encourage that. Again, you know, to at least try to stay active in the material while we're going through it, and keep you awake. Okay, sound good? Okay. A couple other things before we get started. For tomorrow's lab group, for me, okay? It's mostly our part-timers, and then summer, who else is in it? Can we please start right after class? You guys can eat during lab, that's okay, but I have a meeting at 3 o'clock that I have to go to. So if we can start right after, we can be flexible in that time, but we're gonna have to do that to at least get to the lab. Sound good? Sure. Okay. And then lastly, last week, I don't remember what day it was, but I sent you guys a message about the chore list. The chore list is posted in pathology. I know not everybody did their chores last week, so this week, please let's start making that happen, okay? You guys are the ones that are responsible for these areas. You're the ones using them. You're the ones making them messy. So please clean up after yourself, okay? I know when I went in the study room last week, it was a disaster. please, be responsible adults, clean up after yourself. Deal? Okay. All right, let's get going then. So this lecture is,
Just where's the study room? Which one is that?
that's the one that is right in front of the gym room on the left-hand side. So like it has that, the little study table, whiteboard. Okay, you know what I'm talking about?
I'll find it.
I can check it later.
No worries.
Okay, so this is going to be chapters 6 through 8, okay? And we're gonna do just a very, very brief review from last week first. Then we're gonna talk through infectious disease, inflammation and healing, and immune response, okay? So starting first with your review, I just want you to partner up and then talk through your cellular adaptations, cellular injury forms, and genetic disorder types. Okay, so take 8 to 10 minutes just to discuss those things, the highlights from last week's PowerPoint, and then we'll keep going, okay? All right, so we are going to start first with chapter 6. So this is infectious disease in your book, okay? This is going to be really important because most people actually die from infection opposed to an actual pathology that they have, okay, or the actual disease that they have. So it's important also because if you think about a lot of the diseases that everybody gets every year and how easy international travel is, it's very easy to spread diseases all over the world very quickly, okay? And we kind of got a crash course on that with COVID recently. So you can see why this information is important and how it might affect you going forward. Also realize that these trends in diseases and disease development are monitored and reported on by the Centers for Disease Control, okay, and Prevention, the CDC, the World Health Organization, the WHO, and also the United Nations. Okay, so those are kind of the big bodies that are going to be involved with this type of material. Okay, so we're going to start out at the level of microorganisms. Okay, so these are things that you can only see under a microscope. So these are going to include things like bacteria, viruses, fungi, and parasites. Okay, we have two major classes for your microorganisms. There are eukaryotes, which are going to be more like your fungi and your parasites, and prokaryotes, which are going to be things like your bacteria. Okay, so your eukaryotes first. These are organisms that have a membrane-bound nucleus. Okay, so these, an example here are going to be parasites. So parasites can cause infection and disease in other animals, and then those other animals can transmit them to humans. Okay, and then we have our prokaryotes, where your the organisms where the nucleus is not separate. Okay, so meaning that they really lack a defined nucleus. Okay, we also have viruses. These are going to have a protein coat that surrounds a core of DNA or RNA. Okay, viruses are going to be your smallest pathogens. Okay, so similar to what we talked about last week, all of this can either be physiologic or pathologic. Okay, what was physiologic? What was it? A normal occurrence. What's pathologic? Disease. Okay, so all of these could either be good for the body, they could be bad for the body, or they could just be natural. Okay, so we also have pathogens. So your pathogens is the actual disease-causing microorganism. Okay, so infectious disease is going to occur when these microorganisms invade and multiply. Okay, in order for this to happen, the microorganisms need to have specific needs met, okay, in order for them to invade and multiply, okay? So examples of these needs could be things like oxygen, carbohydrates, specific temperatures, specific pH levels, or a living host. Okay, some things need a living host, some things don't need a living host. So that's going to be specific to the certain pathogen that you're talking about. Okay, so at the end of the day, all these pathogens are basically just looking for a specific hospitable environment for themselves. Okay. Okay, so your next bullet point, pathogenicity. This is defined as the capacity of your microorganisms to actually cause disease. Okay? And then virulence is the degree of pathogenicity of a microorganism. Okay? So again, all of this is going to just be based around the ability of a certain pathogen to invade and damage the host cells or the tissues, its ability to produce toxins, its ability to adhere to tissues, and ability to avoid any of the host's natural defenses.
So that would be their ability to avoid and maintain its
Basic.
life.
Yes.
Cycles.
Okay, so next we have bacteria. Okay, bacteria are unicellular. Okay, so they are single cell organisms. Bacteria do not need living tissue to survive. Okay, so they do not need a living host. These are going to be classified and named based on their size and their shape. Okay, so your major groups of bacteria are the three listed here. Okay, so you have bacilli, spirilli, and cocci. Your bacilli are going to be broad-shaped, okay? And these are going to include the bacteria that cause tetanus. Okay, I'm sure you guys have heard of that one, so that's going to be more like lockjaw. It typically survives as a spore in soil, okay? And then it goes in and contaminates puncture wounds, okay? This can also cause seizures, muscle spasms, and ultimately respiratory failure. Your spirilla are going to be spiral shaped, okay, as indicated by the name. These are going to include diseases like syphilis and Lyme disease. Okay, so this can affect your brain, your hearts, or your joints. And then lastly, we have your cocci. So these are going to be spherical in shape. This is going to be more involved in things like pneumonia, respiratory infections, and skin infections. Okay, all of your bacteria are going to be classified as either gram-positive or gram-negative. Okay, and this is really just indicating the degree of thickness for its outer layer. Okay, but what's really actually important about this classification is that it dictates the most appropriate antimicrobial medication. Okay, so that's why you need to know what these are. Okay, so for example, we have penicillin. Okay, that's an example of a drug that affects the cell wall of a gram-positive bacteria. Okay, since human cells don't have cell walls, but these bacteria do, the penicillin can target just those bacterial cells. Okay. All right, so your bacteria, so certain bacteria can also secrete either toxins or enzymes. Okay, so this gives us two big categories for toxins. We have endotoxins and exotoxins. Exotoxins are typically involved and produced by gram-positive bacteria. Okay, and these are going to interfere with nerve conductions, and they can stimulate vomiting.
Stimulate what?
Vomiting.
Okay.
Okay, versus your endotoxins, these are going to be found in gram-negative bacteria. Okay, and that is typically not released until the bacteria dies. We also have spores. Okay, so some bacteria can form spores or endospores. These are very resistant to heat and adverse conditions. Okay, so that basically just means that they are able to survive for a really long time. Okay, so tetanus and botulism, those are both gonna be examples of endospores. Okay, your next three classes include your rickets, chlamydia, and mycoplasmas. Okay, so your rickets, this is gonna be gram negative, okay? It can be life-threatening. This type of bacteria can present in several different shapes, okay? These are gonna be transmitted through fleas, lice, or tick bites, okay? Or either direct bite from them or exposure to their waste products. That can also cause that as well. Okay, chlamydia, this is going to be transmitted through direct contact, okay, typically sexual activity. This is called the silent disease because there is often a lack of symptoms, okay? It is a common cause of infection for the bladder, urethra, fallopian tubes, and prostate glands. Okay, now this does require a host for replication, okay? Since they don't have cell walls and they have a weak cell membrane, they do have to live inside another cell in order to be better protected.
That's the chlamydia report was?
Okay, and then we have your mycoplasmas. So these are going to be the smallest of the microbes that can live outside of a host cell. Okay, so some of these can be parasitic, so think your typical parasites. They also lack cell walls, okay, and they can also assume a variety of shapes, just like rickets. Okay, because they have all of these shapes, they are very resistant to many antibiotics. Okay, an example of this would be primary atypical pneumonia. Okay, we also have our viruses. Okay, these are also acellular. Okay, so they don't have a cell and they require a living host in order to replicate. Okay, so these basically cause infection by attaching to host cells and then using their genetic material in order to enter and take over the cells. Okay, now these are capable of mutation. Okay, so they can mutate, they can change during replication, which is what makes viruses really tricky. Okay, so if you think about things like your common cold, the flu, this is why it's so difficult to develop immunity against these things and why we have to, constantly get a different immunization every year because these things are constantly changing, they're adapting, and replicating in different ways. Okay. Since these viruses lack their own metabolic process, that also makes drugs less effective against them, okay, as compared to something like bacteria. Okay, so here is a list of a lot of the different viruses. They're divided into two groups, okay? So on this side right here, you have your RNA viruses, and then on the other side, you have your DNA viruses. Okay. I'm not gonna go further in depth there. Okay, so moving on to fungi. Fungi are found everywhere, okay? They're on almost every living organism, as well as your dead organic material, okay? So you have 5 basic classes of fungi, and they're going to be categorized basically based on how they reproduce, and then also their structural appearances, okay? So these can either be made of single cells or chains of cells. And they are going to grow best in warm and moist environments. Okay, so fungi have hyphae, which are strands that intertwine in order to form a mass. Okay, when it comes to reproduction, they reproduce by either budding
or by extension of these hyphae, or by producing spores that are then spread throughout the air. Okay? Most fungi are not pathologic. Okay? And those that are, since they typically live off of dead epidermal cells, most of the pathologic infections are going to be very superficial. Okay? So this would include things like ringworm, athlete's foot. Oftentimes these are going to be conditions that are spread through athletic surfaces. So you'll see it a lot in wrestlers, from the wrestling mats, in gymnasiums, pools, those types of environments. Okay? In terms of treatment, you're going to use antifungal medications. Okay? You have both topical, pill form. Usually it's going to be in some type of topical cream that you're going to utilize for this. Okay, so next we have to talk about transmission of infectious agents. Okay, so epidemiology, just the straight definition, is going to be the study of circumstances that influences how infectious diseases are transmitted. Okay, so when it comes to the occurrence of infectious disease, this is going to be based off of several different things. Okay, so incidence, portal of entry, disease course, site of infection, symptoms, and virulence. Okay? And like we said at the beginning of this, we know that there is a lot of potential and ease of spreading these types of infections. Okay? It can happen very quick. You can very quickly have a worldwide pandemic. Okay? So prevention and control is going to be the most important thing that we can do in these situations. Those are going to be determined based off of the knowledge of how certain conditions are transmitted, the microorganisms that are actually involved, and then considering how they can be controlled and reduced in number. Okay, and that's going to be different depending on each type of infectious disease. Okay, so here we have normal flora first, and then opportunistic infections. So resident flora is normal and consists of microorganisms that live on the skin and inside most areas of the body. Okay, so this is totally harmless. Okay, and it basically just helps the body to maintain its normal state. Okay, it can become a problem if your resident flora, that normal flora, is transmitted to another area of the body. So it's in an area where it's not supposed to be. Okay? So that can cause an infection. Okay? We also have opportunistic infections. So this can occur when the body's defenses are impaired for whatever reason, okay? Or the balance among the species of the resident flora is disrupted. Okay, so if you have that normal flora, that's in an area of the body where it's not normally supposed to be. Okay. So for example, antibiotics. Okay, that's a big one that you guys will hear about, where you're taking an antibiotic for a specific infection. It's going to destroy your normal flora in other areas. Okay, because you can't take something that's just specific for one type of area. Okay, so that could result in a different type of infection to occur, because your resident flora in its normal area has also been destroyed. Okay, we also have resistance. So any host's level of resistance is going to be important in order, when it comes to the ability to prevent infections from developing. Okay, so you help to maintain your resistance through keeping your skin intact, your mucous membranes healthy, your body secretions. Okay, so things like your tears can help protect you. Okay, inflammatory responses, we'll talk more about those in a little bit. Making sure you have an effective immune system, you're staying disease-free. All of these things contribute to your level of resistance when it comes to getting an infectious disease. Okay?
And then, of course, we have just natural things. There's a lot of different factors that will decrease your level of resistance. Okay, so things like age. You're gonna see a lot more diseases affecting, very young and very old individuals. Okay? Genetic predisposition, if you're already genetically predisposed to gaining infectious diseases. Any type of immunodeficiency, malnutrition, chronic diseases, things like cardiovascular disease, diabetes, cancers, all of those things are going to naturally suppress your level of resistance.
Is there any times when age is actually a good thing because you have been exposed to so many things? Or just like the immune system itself is more compromised?
It's gonna be more compromised the older that you get.
Having many.
Yeah, exactly. You will, I would say, more middle age, you're probably exactly right. You've been exposed to a lot of things, you've developed a lot of immunity, but then as you really start getting older, everything is just going to naturally reverse. Okay, any emotional or physical stress, as you guys get more into this field, you will start to see more and more how somebody's emotional well-being also affects their physical well-being. So that's always another, part of a patient that you're gonna have to consider, when you're treating somebody. Any invasive procedures, and then poor inflammatory response for any reason. So that one is typically often due to prolonged corticosteroid use. Okay, periods of infection. So before there is any clinical sign of infection, we know now the microorganism has to enter the body, it has to find a site to establish its colony, and then begin reproduction. Okay? So that is only going to happen if the host's defenses are insufficient in order to combat that pathogenic microorganism. Okay? For whatever reason, your resistance is lowered, the pathogen enters, and it is able to reproduce. Okay, so once this happens, you have 3 periods for this infection. Okay, we have an incubation period, prodromal period, and then acute, which can then turn into chronic. Okay, so the incubation period. This is the time between the microorganism entering the body and the appearance of your clinical signs of infection. Okay, that's your incubation period. This could be anywhere between a few days and several months, depending on the microorganism involved. Okay, next we have the prodromal period. Okay, so here the patient is starting to feel fatigue, they might lose their appetite, they're experiencing other symptoms of this illness. Okay, we have the acute period. So this is going to be when the infection is fully developed and the symptoms are at their worst. Okay, the length of this specific period is going to be based on the pathogen's virulence and the host's resistance. Okay, so it will start to subside either once the host's immune response starts to activate or becomes fully effective, or if the pathogen is weakened by some other factor. Okay, so again, depending on the type of microorganism involved, you could have just repeated periods of an acute infection. Okay, so periodic acute episodes. Okay, or this could become a chronic period. Okay, so chronic meaning it could turn into something like septicemia or bacteremia. Okay, septicemia, there's going to be a very overwhelming systemic infection. Okay, this is going to be caused by the pathogens circulating and continuously reproducing in the blood. Okay, bacteremia, here your pathogens are going to enter, circulate in the blood, but this is typically smaller in numbers and typically occurs for a shorter period of time. also have transmission. Okay, so whenever an infection is transmitted, there is going to be a whole chain of events that occurs. Okay, this is called the chain of infection. So your blue ovals in that image indicate the path of the infection, and then listed between them is the steps that you could take in order to prevent the infection from progressing to the next phase. Okay? So of course we know this is going to begin with some type of infectious agent or pathogen. Okay? The reservoir or the source of the infection, it could be either a person with an obvious acute infection, you can clearly see that somebody's sick, or it could be somebody that doesn't have any noticeable signs or symptoms at all. Okay, again, it's going to be dependent on the microorganism that is involved. The portal of exit is going to be the site from which the microorganism leaves. Okay, so example, if you're coughing, okay, it could come through the mouth. If you're sneezing, it could go through the nose. Whatever that exit point is. The mode of transmission is going to be the manner in which the microorganism is actually passed. Okay, so we're going to go through those in the next slide. And then you have the portal of entry to the host. Okay, so this is going to be where the pathogens come in and invade. And then the pathogen has to have a susceptible host in order for the infection to be contracted. Okay, this bottom point here, nosocomial infections, this is really important for you guys because this is basically what happens in healthcare facilities. Okay, because there are so many microorganisms present in these facilities, because of all the sick patients that are there, it's really easy for diseases, conditions to spread very rapidly throughout healthcare facilities. Okay, a lot of it is due to improper hand washing. You guys will, I don't know if you have already learned how to really wash your hands. Okay, it's very important. Food trays, the droplets from each of the patients, anything that anyone touches can basically be a carrier for all of these infectious conditions. Okay, so your most common nosocomial infections include UTIs, pneumonia, and then surgical wound infections. Okay, especially in the ICU, you're going to see a lot of C. diff as well, which we'll talk about later in this slide. Okay, so for you guys at this point, just be aware that things spread really rapidly in these healthcare facilities. They are called nosocomial infections, and as a healthcare provider, you are responsible for making sure you're doing well in your own hand hygiene and you're keeping your surrounding areas clean. Okay, so we have 4 major modes of transmission for infection. Okay, this is very important. Okay, I know a lot of this information is like in one ear, out the other, but this is something that you are going to continuously see and actively utilize when you're practicing. Okay, so these are going to include direct, indirect, droplets, and vector-borne transmissions. Okay, so direct transmission is going to be actually touching an infectious lesion. Okay, it could be something like sexual intercourse, contact with body fluids, crossing the placental barrier to the fetus, anything that is actually direct. Okay, indirect would be something that occurs through, it could be contaminated body parts, contaminated food, or a fomite, which is basically an inanimate object. Okay, so something like bed linens. Okay, you come in contact with an object that is carrying the disease, okay, or carrying the organisms. Droplets will be oral or respiratory. Okay, so these pathogens are going to be expelled from the body and then inhaled or come into contact with another individual. Okay, and then lastly we have vector-borne. So this is going to be where an insect or an animal is the one that transmits the infection. Okay, so again, specifically for us, it's important to understand that the hands are going to be a major route of transmission for many infections. Okay, so again, improper or inadequate hand washing very quickly can spread these conditions from one person to another. Okay, so next we're gonna get into your precautions. So based on these modes of transmission, you will have to adhere to certain precautions. Okay, so the whole point of this is breaking that chain of infection. So finding somewhere where you can intervene so you don't continue the spread of the condition. Okay, so when we talk about universal precautions, this basically means that we consider all blood, body fluids, and waste infected. Okay, whether or not it is actually infected is irrelevant. We consider everything to be infected. Okay, and this is how you guys are going to operate moving forward to help best protect yourself and protect your patients. Okay, so because of this, you always want to make sure that you are utilizing appropriate PPE. What does that stand for?
Personal protective equipment.
Personal protective equipment. Okay. So your development of diseases can really be minimized by following these universal precautions and maintaining appropriate utilization of your PPE. Okay. So understanding your different modes of infection can help you to understand what type of PPE that you need and what you need to wear when you're treating a patient. Okay, so again, at the end of the day, you want to keep everything as clean as possible. Okay, regularly clean your surrounding areas, your surfaces, your clothing, using appropriate disinfectants, antiseptics. Basically, you want to try to destroy all the pathogens that you can so the diseases do not get spread. Okay, so standard precautions and PPE. So your standard precautions are going to be just basically your generalized methods that are implemented in order to reduce your risk of exposure. Okay, so this again, it's going to include your hand hygiene, okay, appropriate hand washing, standards for handling sharps, for cleaning up spills, standards for disinfection and disposal of equipment, standards for handling soiled linens, cleaning the facility, as well as your appropriate use of PPE. Okay, so every facility that you go in will have these certain rules that you have to follow. Okay, there will be certain bins for disposals of certain objects. You know, you'll have your sharps containers, you'll have your place that you have to put soiled linens. So everything has to be done appropriately in order to minimize the spread of infection. Okay, so it is your job to make sure that you're following your standard precautions, you're following these policies in order to minimize the transmission. Okay, so your personal protective equipment, this is used in order to protect your skin and your mucous membranes. Okay, so you are basically creating a barrier between yourself and everybody else. Okay, so this is going to include things like gloves, gowns, masks, shields, whatever the situation calls for depending on the type of infection, in order for you to avoid contact with those microorganisms. Okay, and then after you use this equipment, again, there should be a certain type of disposal bin that you have to put it all in once you are done with it. Okay, there are also eye wash stations. Okay, so this would be used in the event that something splattered into your eyes. Okay, so hopefully you don't ever have to use one. It's not the most comfortable thing in the world, but it can be used to really flush the eyes, mucous membranes, as soon as possible after exposure to any type of substance. Okay, in terms of the actual utilization of this equipment, you would put your eyes in that yellow thing right in the middle, and you would have to flush it for about 15 minutes. So that is what is recommended in order to flush out microorganisms from your eyes. If you have contact lenses in, it is recommended that you take those out before utilizing the eye wash station. Okay? And then of course, if something like that were to happen, do not rub your eyes. Okay? You don't want to risk any further irritation or absorption of any harmful substance. Okay,
What if they don't know that station?
most places should. If they do not, then I would go just to a regular sink and just literally do that for 15 minutes, get the water into your eyes to help flush it out. Okay, airborne precautions. So this is going to be used when a patient has an infectious disease that is spread through an airborne route. Okay, so these extra ones, this is something that is used in addition to your standard precautions. Okay, so these individuals might require a negative pressure room and a private room. So, a lot of hospitals, you typically have 2 people in the room. These patients would only have 1 person in the room. Okay, so they are basically in isolation. Negative pressure prevents airflow from this patient's room going into another room. So it can't get into the corridors, can't get into a neighboring room, anything like that. So you're not exposing other individuals. Okay, so this would be used for individuals who have conditions such as tuberculosis, varicella, herpes zoster, or rubiola. Okay. Droplet precautions. So this is going to involve contact with large particle droplets that contain the microorganisms. Okay, so these are going to be transmitted either through the nose or through the mouth. So when you're talking, you're sneezing, coughing, things like that. Okay, so in order to transmit through this route, this requires contact between a susceptible individual and the infected patient within 3 feet. Okay, so you have to be within 3 feet of this person in order to transmit the disease. So because these have large droplets, like we just said, they cannot remain airborne. Okay, so that is the difference between your droplet precautions and your airborne precautions. Okay, these can't stay in the air because their size, so that's why you have this 3 feet radius basically, and then they're going to drop down. Okay, so your droplet precautions are going to be designed in order to reduce that droplet transmission. So this would include something like wearing a mask. Okay, your diseases that are commonly transmitted through droplets would be your common cold, diphtheria, the flu, meningitis, mumps, mycoplasmas, pertussis, which is whooping cough, strep throat, all of those different things. Okay, and then we have contact precautions. Okay, so this is going to be something that is literally transmitted through physical contact. Okay, so this could be between 2 people, could be between a person and an animal, or between a person and a fomite. What did I say was a fomite? An inanimate object. Okay? So there's a ton of different things that you can see here that can be transmitted through physical contact. Alright? Okay, so again, I know that was a lot to start out with. So, get a new partner, and I want you to talk through your different types of precautions, okay? Do the different types of transmissions, the different precautions that we use to counteract. Okay, so hopefully this first part will be familiar to you guys, just, from living. But common signs and symptoms of infection. So this is really talking more towards your actual clinical manifestation of these symptoms. Okay, so when this infection develops, your common local symptoms are going to include inflammation, pain or tenderness, redness, swelling, and warmth. Okay, those things are your big clinical manifestations of an infection. Okay, if this infection is caused by bacteria, then it will likely also have pus. Okay, there could also be tissue necrosis. You could have swollen lymph nodes as well. And then once this becomes systemic, this could go and then affect any part of your body versus just maintaining a local status. Okay. Now, in terms of your diagnostic testing for infection, in order to determine the actual type of infection that's occurring, they're gonna have to use cultures. So where they actually grow it in a lab or use some type of staining technique. Anyone else having internet issues? I can't get on anything right now.
In and out.
This is really the time for this to happen. Okay, so again, you have your cultures and your staining. So for the staining, they could look for the bacteria, stain it, and look at it underneath a microscope. Okay, so this could be from samples of something like blood, of sputum, other body fluids. They could do all of this with it. There is also drug sensitivity test, where they can actually watch the growth of a microorganism with different drugs, so seeing how it responds to different drugs. Okay, so these typically can take several days, and it's really important to help determine the most effective course for treatment. Okay, so that's all going to be dependent on the type of infection that is involved. Okay. Sorry. Okay, so we also have blood test. Okay, so this is just like your typical blood draw. Okay, these are going to be very commonly used, and they are going to look for any variations in your leukocytes. Okay, so bacterial infections are typically going to cause leukocytosis. Does anybody know what that means? Yes, an increase in white blood cells, okay? Versus viral infections are going to cause leukopenia. What is that?
Decrease in white blood
It's
cells.
decrease in white blood cells, okay? So just that one initial blood test can be a really good indicator of what might potentially be going on. Let's see. Oh yeah, we're good. All right, so just in general, our society, in our society, there has been a very large increase in antimicrobial drugs, okay? And because of that, this has now created a lot of resistance and reduced the ability of individuals to develop antibodies to self-fight these different types of infections, okay? Your bacteria are able to adapt and block the drugs, okay? So this can be particularly problematic when somebody has an infection. So we don't have the self-resistance in order to fight it. The bacteria are able to adapt in order to fight the drugs. So some types of infections can be really difficult to treat and manage. Okay. Loading doses for acute infections. So these can be administered in a loading dose, meaning a larger dose is administered initially in order to achieve effective blood levels much more rapidly. Okay? Again, it's important to understand what type of microorganism you're dealing with before taking this type of action. Okay, you have to know what type of antibiotic to use in order to effectively treat the condition. Okay? So typically, these type of drugs are going to be taken at regular intervals, okay? And it has to be at regular intervals in order to appropriately manage it, in order to control and basically defeat this microorganism, okay? And then same thing, like you guys know when you go to the doctor, you're given a course of meds, and they tell you have to take all of them. So even once you start feeling better, it can still be present inside of you. If you don't finish the course of drugs, it will still be there. So making sure that you educate your patients on making sure they continue and complete everything that they were prescribed, especially when it comes to antibiotics. Okay, so here is a list of all of your different types of antimicrobials. Okay, so not only is it antibiotics, antivirals, antifungals, anything to treat bacteria, basically. Okay. Some of them are more broad spectrum and some are more narrow spectrum. Broad meaning that it could be effective against either gram-negative or gram-positive organisms, versus narrow is going to be specific to either gram-positive or gram-negative. Okay? Like I mentioned earlier, your antifungals, typically this is going to be administered topically, okay? Either directly to the skin or mucous membranes. Let's see. That's really your highlights for this one. So a lot of them you can kind of figure out by the name, so just make sure you understand which type of antimicrobial agent goes with which type of condition. Okay? Your biggest adverse reactions that could happen here is typically going to be digestive tract related. Okay? You could also potentially have allergic reactions, but that is going to be a little bit more or less common in comparison. Okay, so a couple other options here for interventions aside from your antimicrobials are going to be immunotherapy. Okay, so immunotherapy supplements will help to stimulate a host's immune response. Okay. The purpose of that is basically, again, to help either limit or reverse the spread of the pathogen by increasing your reaction to it. So you can use pathogen-specific antibodies in order to do this. They can help to neutralize and remove the infectious agent. Okay? Of course, there is also surgical intervention depending on the individual situation. Okay, so things like draining of abscesses, for example, debridement or removal of infected organs. Okay, all of those things can potentially help to reduce or limit the spread of an infection. Okay, so the majority of your infections are going to occur within certain organ systems. So here are your big three categories for infectious disease. Okay, so your bacterial infections, viral, and then miscellaneous. Okay, so we're gonna go through these a little bit more specifically to get down more towards the area of your actual pathologies. Okay? Okay, so starting first with streptococcal infections. Okay, this is going to be one of the most common bacterial pathogens in humans. Okay, so you have different groups of this. Okay, your first one is typically called gas, so group A. This is going to be responsible for a lot of different infections. It is going to be transmitted through respiratory droplets. Okay, impetigo is a very common example of this type. Okay, impetigo is going to be most common in children 2 to 5 years old. You're typically going to see this where there's very humid and warm weather. Okay, your big risk factors for this: overcrowded housing, close contact in schools, okay, poor hygiene. All of those things are going to play into this condition. Okay, in terms of actual physical presentation, there's typically going to be a lot of skin lesions. It's most commonly going to occur on the face. Okay, they're going to start really small, just as small macules, and then develop into more pustular, encrusted type vesicles. And then that type of infection is going to be spread through scratching. Okay, we also have streptococcal pharyngitis. So this is going to be your strep throat. Okay, so your bacteria are going to colonize in the throat. Streptococcal cellulitis. This is going to be more inflammation of the skin and subcutaneous tissues. Typically, you see this more caused by wounds, by burns, or other skin type injuries. Okay, and then this last one we have listed, your puerperal sepsis, is going to be more linked to pregnancy. Okay, so this type of bacteria can colonize on the mother, or it can be transmitted through healthcare personnel. Okay, so that's your big group A. We also have group B. Okay, group B is going to include conditions such as meningitis, pneumonia, and sepsis. Okay. This is going to be transmitted most commonly by inhalation of droplets from respiratory secretions, or it could also occur through direct contact. Okay, next we have staphylococcal infections. These are very proliferative, okay, and they can exist on inanimate objects for a very long time, okay? So this would include things, at the top I have listed bruncles. Okay, these are like boils. So they can begin in your hair follicles and then spread into the actual dermis. So typically they're gonna start out as small but firm, painful little red nodules, and then they will develop and grow into larger masses that are even more painful and typically will have pus that drains from them, okay? These, despite, what you may want to do, you should not squeeze these, okay? Because they can therefore spread the disease more rapidly once that material is on the outside, okay? So this is going to be spread through direct contact, and then the infection, of course, can then enter through any type of damaged skin. We also have Pseudomonas, so this is going to be a gram-negative bacteria. Again, this is gonna be more linked to hospital-acquired infections, okay? So this is really important because, again, transmission is largely due to transmission from healthcare workers, okay? So this is a large opportunistic pathogen. You're gonna see it most commonly in places like the hospital sinks, urine receptacles, places like that. Okay, so again, maintaining a clean environment is very important. Okay, so clinically, for this type of patient, they're going to have draining sinuses. They might have cellulitis, osteomyelitis, ear infection, gangrene, pneumonia, bronchitis. It can also attack the central nervous system and result in something that resembles meningitis as well. All right, C. diff. I mentioned this one earlier. This is something that you guys are likely going to see a lot of, okay? This is going to cause really severe diarrhea and serious intestinal issues, okay? Again, very common in elderly. It is spread rapidly in hospitals and nursing homes. It also can affect those who have been on long-term antibiotic use, okay? Again, going back to the alteration of the GI flora. Typically, you're gonna start to see symptoms of this about 5 to 10 days after someone has started a course of antibiotics, okay? Clinically, they're going to have very watery diarrhea. It's gonna happen the minimum criteria is 3 episodes per day, but typically it's a lot more than that, okay, for at least 2 days. They'll likely have fever, loss of appetite, nausea, and then abdominal pain and tenderness. Cytomegalovirus, so this is something that really can range significantly in severity, okay? This is gonna be transmitted through blood, body fluids, or transplanted organs, okay? It can also be asymptomatic, okay? So even easier for it to spread if you don't know you have it. This virus can cause hepatitis and splenomegaly. It can result in a spontaneous abortion, stillbirth, or postnatal death, okay? So it is very serious. This is a major cause of illness and death in immunocompromised patients, okay? So people who are already immunocompromised. All right, herpes simplex virus, okay? This is also gonna be a very common recurrent infection of the skin, eyes, mouth, lips, and genitalia, okay? Severe infections here can include encephalitis, which is gonna be inflammation of the brain, meningitis, which is gonna be inflammation of the meninges, and then neonatal herpes as well, okay? This is going to be transmitted with very close contact with a person who has an actively present virus, okay? In terms of the actual clinical presentation, these patients will present with blistering sores, itching, pain with urination, or it could very much present like they have the flu. Okay? The diagnosis is going to be made based on the presence of the skin lesions. Yes?
Will you go back through, like, you said that it does, like the meninges, and then I think two or many others.
Yep, so encephalitis, so it's gonna be inflammation of the brain. Meningitis, which is gonna be inflammation of the meninges in the brain. And then neonatal herpes.
Thank you.
Mhm. Okay, next we have shingles. So this is going to be a herpes zoster infection. It occurs when the varicella zoster virus reactivates. Okay, what is varicella?
Chickenpox.
Chickenpox. Okay, so your chickenpox virus reactivates, that occurs in the posterior dorsal root ganglion. Okay, so here, we're gonna talk about dermatomal patterns tomorrow. Does anybody know what that is?
Patterns on the skin.
It's a pattern on the skin, okay?
Like, hair in the skin, intermittent knot,
Exactly, so you have your nerve roots. Your nerve roots will innervate certain areas of the skin. And so there is a specific pattern that every nerve root will follow. Okay, again, we're gonna start talking about that tomorrow, and then we'll talk about it for the next year. But basically, this, when you get shingles, this occurs in that dermatomal pattern. So you have one specific nerve root, that area of skin is where this pattern of basically chickenpox is reactivated. Does that kind of make sense? Okay. This is going to occur mostly in elderly individuals, in HIV infected patients, and then of course anybody who is already immunocompromised. Okay? The actual lesions are identical to chickenpox. Okay, so it is the same lesion. They're gonna have that pain or the rash again on that involved dermatome. And so it's pretty easy to identify once you know your dermatomal patterns. Okay, so treatment here is going to be oral antivirals, and then anything just to try to help make it feel better, wet compress. They might give systemic analgesics just to help make you feel better as well. In terms of prevention for this, it is recommended that children get the varicella vaccine in order to prevent the primary infection, which is your chickenpox, so that it can't be reactivated later in life.
So if you never had the primary virus, you can't get.
Correct. Okay, influenza, so the flu. So the flu is gonna be a viral infection, okay? There are several different viruses in this actual category. Again, your highest risk populations are gonna be young children, older adults, those who are already immunocompromised, pregnant individuals, and then anyone with underlying health conditions, okay? Spread of the virus here is going to occur through airborne droplets, through contaminated items, or direct person-to-person contact. Okay, most common mechanism of spread is going to be airborne. The typical incubation period for the flu is 1 to 4 days, okay? And these people will present with what looks like, you know, the common cold, sore throat, chills, fever, etc. Your treatment here is going to be antivirals, that's gonna be pretty highly effective, and antibacterials. Okay? The important part of that is you don't want it to progress to pneumonia. Okay, so the antibacterials are used in order to prevent that from happening. Okay. For the vaccine, we know that we get a new vaccine for the flu every year. That has been shown to decrease infections by 70 to 90% in healthy adults. Okay, and speaking of, flu shots are due by October 1st, so we are now in, that time period, do not forget about it. Okay, most of your clinics will require that. All right, next we have mono, infectious mononucleosis. This is going to be your clinical manifestation of the Epstein-Barr virus, okay? I'm sure you guys heard of this as teenagers. It is most common in teenagers and young adults. Most common form is going to be transmitted through kissing, okay? The actual clinical presentation, these people are going to have swollen lymph nodes, fever, and pharyngitis. Oftentimes, this is going to look very similar to strep throat, okay? The fever is typically the worst in the first 2 to 3 weeks, but these symptoms can last for months, okay? This is a very long condition. It can also have a lot of complications that are associated with it, okay? So again, this can range significantly in severity, but it can ultimately result in neurologic complications, encephalitis, Guillain-Barré syndrome, peripheral neuropathy, all different kinds of things can happen from this. Overall, the treatment is not very good for it either. So most of the treatment is supportive. So encouraging them to rest, avoiding heavy activity, avoiding contact sports, just trying to make them feel better. But otherwise, there's not much that can be done once this is actually contracted. Okay, last condition here is going to be Lyme disease. Okay, Lyme disease is transmitted by ticks. Okay, so the ticks typically have to be attached to the skin for more than 36 hours in order to actually transmit the disease. Okay, this is the most common tick-borne illness. It is most prevalent in like later summer, early fall. Okay. The picture up here is a really good one to see what it will actually look like. It looks like that bullseye target, okay? So you're going to get an erythema reaction. It will have like that red dot in the middle at the site of the tick bite, and then it starts to expand from there. These individuals will have also a range of symptoms that they present with. And again, it can look very similar to something like the flu. So they'll be very fatigued. They might have a fever, headache, a stiff neck is another one. And a lot of times this can also go unnoticed, and then it can progress from there. So this can result in really severe neurologic abnormalities as well. So things like meningitis, Bell's palsy, or, really like radiculopathies, peripheral neuropathy, things like that. Okay. Since this is so non-specific, again, if you don't have something where you directly see this, it can be in a spot where you don't see it. It can really go misdiagnosed for quite some time. Okay. Treatment here is antibiotics. And then just one more important point, we as humans do not develop immunity to this condition, okay? So it's something just because you've had it once doesn't mean that it can't happen to you again. Okay, so it is possible to become reinfected. All right, chapter 6 done. You guys need another break?
Yes, please.
Okay, made this one a little bit shorter, we still got a lot to go through, but take, 5-6 minutes, walk around. All right, moving on to chapter 7. Okay, so this one is gonna be more based on inflammation and your natural healing response. Okay, so we know that inflammation is going to be a protective response to any type of injury or infection. Okay, so the goal for this is for the body to try to isolate an infected area and prevent that infection from spreading. Okay, so your main system that is involved in this is going to be the circulatory system. Okay, make sure you write that down. You might see that again later. Okay, so the circulatory system. So again, main system involved in this process. So this increases the movement of plasma and of blood cells from circulation into the tissues that are surrounding an injury. Okay? The fluid involved in this is called exudate. Okay, so this fluid is really what is helping to defend against the infection and facilitate the tissue healing and the tissue repair. Okay, so again, this is your protective response, and it's working to eliminate the cause of cell injury, to help repair any type of damaged tissue, and ultimately to heal any wound that is present. Okay, so here is listed your actual physiologic mechanism of infection, or of inflammation, I'm sorry. Okay, so the body has different ways of protecting itself, and you have these different lines of defense. Okay, so you have first line of defense, second line of defense, and third line of defense. The first line of defense is going to be your actual mechanical barrier. This is what is created by your skin and by your mucous membranes. Okay, so it is literally trying to block the bacteria and the harmful substances from entering the body. Okay, that is your first line of defense. We also have body secretions included in that. So if you think about things like your saliva or your tears, these contain enzymes to help destroy any foreign materials or foreign enzymes. Okay, so all of that collectively is your first line of defense. Then we have your second line of defense. Okay, this is going to include phagocytosis and inflammation. Okay, phagocytosis is where your neutrophils, what is a neutrophil?
Kind of leukocyte.
What is it?
Kind of leukocyte.
A type of white blood cell, one of your leukocytes. And your macrophages, okay, so these work to engulf and destroy the bacteria, the cell debris, or the foreign matter. Okay, so then this inflammation can help to limit the effects of the injury or the foreign material. Okay, we also have in this section what is called interferons. I don't think that's listed. But these are more non-specific agents that help to protect the uninfected cells against viruses.
Can you say what that's called again?
Interferons. Okay, and then lastly here we have your third line of defense. This is your actual immune system. Okay, so this will help to produce or stimulate the production of antibodies or specific lymphocytes. Okay, this occurs after the exposure to the foreign substance. Okay, as you guys have probably seen before, you have certain signs and symptoms that are consistent with the presence of inflammation. Okay, so this is basically just a warning sign for you guys as providers to know that there's a problem somewhere in the body. Okay, just because inflammation is present does not mean that there is an infection. Okay, there could be an infection, but it is not definitive because there is the presence of inflammation. Okay, so again, infection is one potential option, but you could have inflammation from other things as well. Okay, think about, cuts, allergic reaction, insect bites. All of these different things could cause an inflammatory reaction, but not necessarily indicate the presence of infection. Okay, so the actual symptoms for somebody with an inflammatory response that is local is going to include redness, warmth, swelling, pain. Okay, those are your big indicators. Sometimes there could also be loss of function depending on where in the body this is occurring. Okay, this could be immediate and very acute. It could be short-lived, or it could be longer in duration. Okay, it just depends on what's actually going on. Okay, so starting first with acute inflammation. So if there is a damaged tissue, okay, these damaged cells are going to release chemical mediators into the interstitial fluid, okay, as well as the blood. Then this is going to facilitate a vascular response and a cellular response. Okay, so for your vascular response, this is going to cause a local vasodilation. Okay, what is vasodilation?
Plus, the blood vessels.
Exactly, so basically a widening of your blood vessels, that is vasodilation, okay? This will then cause hyperemia, which basically brings in all of that blood, so excess of blood in the vessels in order to supply the affected organ or the affected tissue. Okay, with that, your capillary membrane permeability also increases. So this allows plasma proteins in the fluid to actually shuttle into the interstitial spaces. Okay, so this will help to dilute any type of toxic material. Okay, we also have a cellular response. So that was your vascular response. We also have the cellular response. So here you have your leukocytes. What's leukocytes? Your white blood cells that are going to be attracted to this area of inflammation. Okay? So your neutrophils, your monocytes, your macrophages are all going to collect along the capillary wall and then move into the interstitial area. Okay? And that's where they're actually going to try to go into defending mode with phagocytosis. Okay, what is phagocytosis? The eating of the cells. Exactly. Okay, so they go in, they engulf the cell, and then they're going to help to destroy any of that bacteria, the cell debris, or the foreign matter. Okay, so here are some different chemical mediators that are released after your tissue injury. Okay, these are all listed in your textbook, table 7-1. So the chemotactic factors are going to attract the neutrophils to the site. Okay, and then all of these things kind of work together in order to increase that vasodilation, that increased capillary permeability that we were just talking about. Okay, so here are some more of them. You have your leukotrienes. This is going to be a little bit more delayed, so it doesn't happen as immediately as the other. And then your platelet aggravating factors and your prostaglandins as well. So all of these things are involved in your inflammatory response. Okay, so again, when we talk about your leukocytes, these are just white blood cells. Okay, you have several different types of leukocytes. Okay, and they all have different jobs. So because of that, when they do blood work, this is one of the first things that they're going to look at. Okay. How many white blood cells do you have first, and then what type of white blood cells? So the presence of these different leukocytes can actually indicate what is happening in the body. Okay, so here's a list of all of them. We have your basophils, B lymphocytes, eosinophils, macrophages, monocytes, neutrophils, and the T lymphocytes. Okay, and they all have different jobs and will present at different times depending on what's going on in the body. Okay, we also discussed the exudate earlier. Okay, so again, this is going to be that interstitial fluid. Okay, there are several different types of exudate, and again, that can give you indication as to what is actually happening in the body. So these are terms that you are going to use when you're in clinic, because this is how you're going to document what you actually see. Okay, so if somebody has some type of exudate that's on their skin, you need to be able to identify what type it is and document that on the computer. Okay, so first we have a fibrinous exudate. Okay, so this is going to be really thick and really sticky. So it has a very high cell and fibrin content. Okay, so this is going to indicate that there is going to be an increased risk of excessive scar tissue in the area. We also have hemorrhagic exudate. This is basically bloody exudate. Okay, so this is indicating that there is some type of blood vessel that has been damaged. Okay. We also have purulent exudate. This is a very common one that you guys are going to see. This is going to be thicker in quality and is going to be more yellowish or greenish in color. So basically this is pus. Okay? There's a higher amount of leukocytes and cell debris with the microorganisms. Okay, so this is going to be more indicative of a bacterial infection. Okay. Lastly, we have serous exudate, so this is more watery, okay? So typically, this is going to be mostly this, a clear fluid. It might have a small degree of white blood cell or small amount of protein in them. Typically, you'll see this with allergic reactions as well as burns. Okay, so if you think about like a liquid-filled blister, okay, that would be an example of a serous exudate. That liquid, that clear liquid on the inside of the blister. Okay, we already talked about your manifestations of inflammation. So what were some of your local signs and symptoms that you're gonna see? Yep. Redness, pain, warmth, swelling. Okay, sometimes loss of function. Okay, so those were local inflammation. You can also have general manifestations of inflammation. Okay, so this would be things like malaise, really general discomfort, a mild fever, fatigue, headache, reduction of food intake. So all of these things can also be caused by the presence of an infection. Okay. Typically, if somebody has an infection, the fever can also become really severe because this is part of the body's defense mechanism, okay? A high fever can work to help to impair the growth or reproduction of a pathogen, okay? Same thing with shivering. That's also something that can commonly occur because it helps to increase the body's cell metabolism. So again, all of these things are occurring in order to try to help fight off the infection that is present. In terms of your diagnostic test, again, the first thing that they're gonna do is blood test. Okay, specific for this, they are looking for any type of change in white blood cells. Okay, so again, leukocytosis, which is gonna be your increased white blood cell count. Looking for any type of proteins, increase erythrocyte sedimentation rate, or the presence of cell enzymes. Okay, so again, a lot of these do not necessarily indicate the cause or the site of an infection. It just tells you that an infection is present. Okay. And then like we talked about earlier, your differential count. So looking at the different type of blood cells that are present, how many of each, that can also help a doctor to distinguish between a viral versus bacterial infection. All right, so moving on to some of the effects of inflammation. So there can also be severe inflammation with necrosis. Okay, meaning that that tissue is going to actually be destroyed and it needs to be repaired. Okay, so this is one of the things that can cause the cell enzymes to become elevated in the blood. Okay. If the necrosis is extensive, it can lead to ulcers, tissue erosion, or tissue death. Okay. Any type of deep ulcer is going to result from severe or prolonged inflammation. Okay. It can also lead to really strong muscle spasms or muscle contractions. It can get so severe that it forces a joint out of alignment. So a lot of different things can happen just beyond what you might normally think of as an inflammatory process. We also have chronic inflammation. Okay, so this is anything that's going to last for several weeks, months, or even years. Okay, we know acute inflammation is typically going to be very short in duration. Okay, versus your chronic, this can be due to either recurrent inflammatory responses or a progressive active inflammatory process. Okay, so if you think about something like rheumatoid arthritis, okay, that is an inflammatory process that someone is always going to have. It's not just something that's going to go away. So you have these periods of exacerbation over time. Okay, some days it might be better, some days it might be worse. going to be very episodic in nature. Okay? You can also develop chronic irritation due to bacteria or long-term immune abnormalities. Okay? Or smoking, that's a very common one that you'll see as well. When somebody has chronic inflammation as compared to acute, then their symptoms are typically not as significant as what we previously looked through and discussed. Okay? So this is going to be much more mild compared to acute inflammation. So here is some treatment of inflammation. Okay, so medications, ASA, acetaminophen, NSAIDs, prednisone, those are going to be very common in terms of inflammation. Okay, you have your RICE treatment, which I'm sure you guys have heard of, rest, ice, compression, elevation. It's fine. A lot of this, you have to consider like the pros and cons of it, right? Your body is going through an inflammatory response for a reason. So stopping that or hindering that is also not always the best option. Okay, so again, having to weigh the pros and cons, understanding what's happening, or what's causing this from an underlying reason, and then progressing as appropriately. Okay. In terms of your RICE acronyms, specifically for us when it comes to more orthopedic conditions, compression and elevation are going to be much more important, depending on what is actually going on with the person. Elevation can really help to pull out the swelling from a limb and help to normalize function. Compression is a good adjunct. Rest and ice might not always be the reason, just depending on what is going on. Okay, when it comes to actual tissue repair, so this is going to overlap your inflammatory process. So the body is going to start to work to heal itself even when the injury is still present. Okay? This is going to be an automatic response of the body in order to try to help maintain its normal structure and its normal function. Okay? So we have several different methods of wound healing. Okay? So the big ones that we're going to talk through are called resolution, regeneration, and replacement. So starting first with resolution, this is going to occur just after minimal tissue damage. Okay, so the cells recover, the tissues return to normal, and this will occur in a very short period of time. Okay, so something like a mild sunburn would be an example of this. Okay, next we have regeneration. So this occurs in damaged tissue where the cells are capable of mitosis. So where your cells are actually replicating and they're dividing. Okay? So the damaged tissue is going to be replaced by identical tissue from proliferation of nearby cells. Okay? So an example here is going to be your liver. Okay? The liver can actually regenerate. Okay, we also have replacement. Okay, so this occurs after more extensive tissue damage. So where the cells, or in areas where the cells cannot undergo mitosis. Okay, so they can't regenerate. So somewhere like the brain or the lungs. I'm sorry, the brain or the heart. Okay. So here, a different type of tissue will form. So connective tissue will form. So this is going to be more like scar tissue or fibrous tissue in the area that is actually going to replace the original tissue. Okay, we also have what is called healing by first intention versus healing by second intention. Okay, healing by first intention means that your wound doesn't have any type of foreign material or necrotic tissue. In terms of its edges, the edges are held close together. Okay, versus healing by second intention, here there's going to be a much larger break in the tissue. Okay, so it requires an increased inflammatory response. It's going to have a longer healing period, and there's going to be much more scar tissue formation. For your tissue repair, okay, you're going to see this type of image a lot. inflammation, proliferation, and remodeling. Okay, so make sure you understand those terms, commit them to memory as we go through the next few slides. So, tissue repair, this is going to start very quickly after an injury. Okay, it's gonna start with the formation of blood clot, activation of the inflammatory process, and then the beginning of phagocytosis. Okay, so after about 3 to 4 days, that foreign material or the cell debris has gone through phagocytosis. Okay, the granulation tissue from nearby connective tissue will grow into the gap where the actual injury is. This tissue is typically very highly vascularized. Okay, new tissue is going to look more pink. It's going to look kind of moist as that new skin is developing. Okay. So like I said, for your phases of healing, we have inflammation, proliferation, and maturation or remodeling. So your inflammation period is going to begin immediately after an injury. This typically will last for between 2 and 5 days. Okay, this is going to involve hemostasis and inflammation. Okay, hemostasis is going to be vasoconstriction. Okay, so we're shutting down the blood vessels, we're making them smaller, we're constricting the vessels. Also platelet aggregation and blood clot formation. Okay, and then once the actual inflammation process starts, this will then involve your vasodilation and your phagocytosis. Okay, for proliferation, this is going to last from about day 2 through 3 weeks after the injury. This portion will include granulation, contraction, and epithelialization. Okay? Granulation means that we're basically working to produce new capillaries. Okay? Contraction is where those wound edges are being pulled close together. And then epithelialization is covering the actual epithelium. Okay? And then lastly, we have maturation, which is your remodeling phase. This can last from between 3 weeks to 2 years. So here, your new collagen is forming, and even once it is totally healed, it is likely only to be about 80% the strength of the original tissue. Okay, so it's never going to be quite the same after that injury. Good?
Yeah, it was just modality. Is it
You
different
had
in
70,
modalities?
right?
It's 70.
Okay,
Is
let's
it
go
like
70 to
roughly?
80 then, people.
Okay.
Okay, so I want you guys to get a new partner, talk through your phases of healing. Okay, inflammation, proliferation, and maturation. How long do they last? What do they include? What do those terms mean? As you guys know, healing is actually going to be affected by a lot of different things. Okay, so you have to consider the severity of the injury first. Okay, how large is the gap, if there is a laceration, whatever it may be. So you know smaller gaps are going to heal a lot more quickly than a deep gap or a large gap. Okay, healing is going to be facilitated by youth. Again, as you age, things are going to be much more difficult to heal. Good nutrition, adequate hemoglobin, effective circulation, cleaner wounds, so less potential for infection, and then of course, no complications. All of that will facilitate healing promotion. Okay, delays, advanced age, poor nutrition, dehydration, low hemoglobin, or circulatory problems. If there is excess irritation, bleeding, or the presence of infection, any other things going on in somebody's life, if they're going through radiation, if they're going through chemotherapy, all of those things are going to result in delayed healing. Okay? Scar shrinkage. Okay? So scars will naturally shrink over time. Okay? Even though, like, theoretically scars are a good thing, sometimes they can also be problematic. Okay? So you can get scar adhesions, and this is going to be really important for us from an orthopedic standpoint, specifically post-operatively. Okay? when you have scar tissue formation, you guys have to use your hands to mobilize the scar tissue. Okay, scars don't just happen on the outside of the skin. It's not just superficial, they also happen underneath the skin. So it's important that you guys are able to get in there with your hands and mobilize the scar so it doesn't become adhered. Okay, so again, we'll talk about that more once we get to orthopedics, but just something to consider for right now. Okay, but scars, this tissue will shrink over time. So that being said, it can also restrict range of motion. It can cause joint deformity. So that's why you guys really have to intervene with this as well. Okay? If it's more internal, it can also cause shortening or narrowing of your internal structures. So any type of ducts or tubes in the body can also become shrunk due to scar tissue formation. Okay? And then bone healing. Okay, so this is going to be very similar to everything we just talked about. So you have your 3 primary and overlapping stages. I know somebody pointed out that this does not perfectly align with what you guys learned in modalities, but also understand that this is not an exact science, right? You have a range of things. It's gonna be different depending on the circumstances, depending on the individual, but you should still be able to identify what phase somebody is based on your context clues that are written in your question or on your board exam, whatever it may be. You still should have a general idea of, you know, where they are, even if your days might be a couple days off, okay? So first we have your inflammatory stage. This is going to occur 2 to 4 weeks after a fracture, okay? So here you're gonna have a hematoma that forms within the fracture site. This is going to happen pretty immediately, so over the first few hours and days. And then your inflammatory cells are going to come in and they're gonna infiltrate the bone. And then you're gonna have your granulation tissue, your vascular tissue, and your immature tissue that is actually formed. Okay? In the repair stage, this is going to be 1 to 2 months after a fracture. Okay? So here, your bone ends are going to become joined, they're going to help stabilize, and then new bone tissue is going to start to form. Okay, so this is called a fracture callus. So here, this is good because your callus is forming, but it's also still very weak and continues to require protection. Lastly, we have the late modeling stage or the remodeling stage. Okay, this is going to happen between months and years after a fracture. So here, the body is taking that weak fracture callus and transforming it into stronger bone. Okay, so hopefully over time, initially when the callus forms, it's going to be much bigger than the original bone. So over time, hopefully that should shrink slightly and more closely restore the normal shape and size of the bone. Do you have a question?
Yes, fracture calluses as well, called it fibrosis.
Not necessarily. So the fibrosis is typically more like fibrous tissue that's more like scar tissue versus this is going to be more like almost think like a calcium deposit. So it's forming a different type of tissue over top of that bone. Let's see, so again, leg remodeling, you're taking that callus and turning it into strong bone. Okay? At this point, you do need loading through the bone. Okay? Versus the first 2 stages, it's going to be more protected. You might be in a cast, you might be immobilized. In the late remodeling stage, you do need weight bearing in order to help to strengthen that new bone. All right, so that was chapter 7. So from here, let's go ahead and take a short break, okay? And then we'll finish off with chapter 8. Okay, so take again. For today, we have chapter 8. So this is going to be more immune response, hypersensitivity, and autoimmune disorders. Okay, so basically a little bit deeper of a dive into what we've already talked about. Okay, so first, we already said the immune system is a major part of the body's defense system. Okay, which line of defense is it?
Third.
Third line of defense. Okay, that's your immune system. Okay, so again, the responsibility of the immune system is to recognize and remove foreign materials. Okay, so this has to be able to recognize an invading antigen as foreign, and then it will facilitate a specific response in order to address that particular antigen. Okay, this system also basically has memory. Okay, it has memory cells that can help to protect the body again if the same invading antigen occurs, okay, or returns. Okay, so this is how your body develops its immunity. Okay, so when you're talking about the actual defense mechanisms, this is going to include your phagocytosis, which is what? The cell eating, and the active inflammatory process. Okay. All right, so the immune system, it has different components. Okay, so this is going to include your lymphoid structure, the immune cells, and then the tissues concerned with immune cell development. Okay, so what type of immune cells are responsible for actually identifying and removing the foreign materials? What did we say earlier? Say it loud.
Macrophage.
Macrophages. What's the other one? Your lymphocytes. Okay, lymphocytes and macrophages. So, oh, they're listed up here, guys. Nice. All right, so your lymphocytes. These are going to be the primary cells that are used in the immune response. They originate in the bone marrow. And then once the actual lymphocytes mature, they are known as immunocompetent, okay, which means that they can recognize and react to the antigens. Okay, and then your macrophages, these are going to develop from the monocytes, and these are going to occur in the liver, the lungs, lymph nodes, etc. Okay. All right, so your macrophages are going to intercept, engulf, and engulf the foreign material, okay, or your antigens. So this is going to help to initiate the actual immune response, okay, or inflammatory response. Your macrophages can also secrete monokine and interleukins, which will also help to activate the lymphocytes in the inflammatory response. Okay, so like we said earlier, just to highlight again, the immune system is going to use and rely on the blood and the circulatory system in order to facilitate this transportation and communication. Okay, so again, circulatory system is very important here. All right, so again, here's just a further breakdown of the different components for your immune system. So for your lymphoid structures, this is going to include your things like your lymph nodes, the spleen, the tonsils, your lymphoid tissue, and then lymphatic circulation. Okay, we will learn more about the lymph system in anatomy and kinesiology, but toward the end of the semester. The actual immune cells, like we said last slide, this is going to include your lymphocytes and your macrophages. Again, they work to identify and remove the foreign material. And then your immune tissues, this is going to include your bone marrow, which is the actual site of origination for the immune cells. And then the thymus, which will help these cells to actually mature. Okay. And then we also have chemical mediators, which we know are going to play an important role. And again, blood circulatory system is how all of this is going to work and function together through the body. Okay, this is just a list more for your reference. Okay, this can be found directly from your book, but it's basically just listing out all of the specific components for the immune system. Okay, so you have your organs, the cells, and then the actual chemical mediators that are involved in this process. All right, antigens, we've said that word a lot today. So these, again, they can either be human cell surface antigens or foreign substances, okay? You're gonna have self-antigens that are gonna be present on all of your cell membranes, okay? These are gonna be coded by the genes from your parents, okay? So basically, an antigen in general is going to be any type of substance that triggers an immune response, okay? Those are your foreign antigens. Okay, so back to our lymphocytes here. So lymphocyte, we know, is the primary cell involved in the immune response. So we have two major groups of lymphocytes. We have T lymphocytes and B lymphocytes. So these determine the type of immunity that is going to be initiated. Okay, so your two types here, I don't think they're on this slide, but maybe the next one, are cell-mediated or humoral immunity. Okay, so T cells, we know, are going to come from your T lymphocytes. Okay, that is going to come from the stem cells in the bone marrow. Okay, and then these are going to travel to the thymus for further differentiation and development. Okay, so that maturation process is occurring in the thymus. Okay, when these T lymphocytes have protein receptors on their surfaces, okay, that can be used to recognize antigens. That means that cell-mediated immunity has developed. Okay, so because of this, your T cells can directly destroy invading antigens. Okay, these T cells can also reproduce, and they can also activate other T cells or T lymphocytes or B lymphocytes. Okay, these are going to be most effective against cells that have viruses, fungal or protozoal infections, cancer cells, or just foreign cells in general, so things like transplanted tissues. Okay, we also have B lymphocytes. These are going to be responsible for humoral immunity, okay? So they produce antibodies or immunoglobulins, okay, which are proteins. These are gonna be found more in general blood circulation. These are also divided into 5 different classes. Okay, so we have these listed here. So you have all of these little acronyms basically to remember, okay? So you guys can read through these. We're not gonna go super in-depth here, it's not necessary, but just make sure you know what the 5 classes are. So IgG, IgM, IgA, IgE, and IgG. Okay, so for your complement structures, during an actual immune reaction, specifically with IgG or IgM, the complement system is often activated, okay? This involves inactive proteins that circulate through the blood, okay? So basically, when an antigen-antibody complex binds to an initial complement component, this sequence of activation begins, okay? And this will result in the destruction of an antigen when the cell membrane is damaged. Okay, this is also going to initiate the inflammatory response. Okay, so when it comes to your immune response, you have 2 different steps here. We have the primary response and the secondary response. The primary response is going to occur at the beginning, so in that initial exposure to some sort of antigen, okay? So again, that antigen has to be recognized, it has to be processed, okay? And then that is going to facilitate the initiation or the development of the antibodies or sensitized T lymphocytes, okay? So those T lymphocytes are now sensitized to the antigen. Okay, so depending on what is causing this, what the actual situation is, that whole thing can take, you know, it can be very quick, or it can take up to several weeks for that to actually occur. Okay, but after this initial rise, the antibody levels will fall back down. Okay, then we have our secondary response. So this goes back to what we were talking about with the memory cells. Okay, so this is going to occur when you have an exposure to something that you've already been exposed to, okay? So again, your memory cells are activated, they understand you've already been exposed to this certain antigen, and then your body's able to produce a large number of matching antibodies or T cells very quickly, okay? Because it's already been exposed to it, it can fight it off a lot more quickly, okay? It can continue to do that for many years. Okay, so that is your secondary response. You've already had that primary response previously, so now your body knows how to react, and it can do it at a quicker pace. Okay, so there are unique antigens on the individual cell surfaces that can help to distinguish between foreign and normal cells. Okay, so these are referred to as non-self or foreign versus self, which are your normal cells. Okay, so during this immune response, the body is able to recognize the self cells and recognize the invader cells, or your non-self cells. Okay, and then it's going to develop that specific response. It can store it in its memory, and then allows it to remember the antigens if they return. Okay, which would be called what type of response? Secondary response. Okay, so primary response, first exposure; secondary response, subsequent exposure. Okay. Okay, so next, in terms of your actual foreign material, okay, you have to be exposed to a foreign material and develop immunity to it before the body can actually defend against it. Okay, so this is going to become an issue, especially when it comes to malignancy. Okay, so if you have a malignant neoplasm, that can have some type of abnormal cell membrane, and the immune system should identify it as foreign. Okay, so a normal immune system is going to play an important part in identifying and responding and fighting off cancer. Okay, but if your immune system is suppressed for whatever reason, it is not going to do that procedure appropriately. Okay, it might not identify all of those cells as foreign. Okay, so it's not going to remove all of them. Okay. We also have acquired immunity. Okay, so this is important when it comes to interaction between different species. So humans are not susceptible to diseases that a lot of other different types of species or a lot of animals are susceptible to, and vice versa. Okay, so there is a natural immunity that is specific to each individual species. Okay, there's also innate immunity, which is more specific to certain genes and typically controlled by race. Okay, so usually a person will only have one episode of a bacterial or a viral disease because you have those memory cells that are able to recognize and defend against it moving forward. Okay, so for this, just make sure you understand the different terminology and the definitions. You don't really need to dive in deeper there. Okay, but building on that, we also have active and passive immunity. So basically, your immunity can be acquired in 4 different ways. Okay, you have active natural immunity, active artificial immunity, passive natural immunity, and passive artificial immunity. Okay, so your active immunity basically develops when the body develops the antibodies or the T cells in response to that specific antigen. Okay, so then in your active immunity, we have natural and artificial immunity. Okay, so your active natural immunity is going to occur when you are directly exposed to an antigen. Okay, so you are acquiring that immunity because you've been exposed to it. Okay, versus active artificial immunity is when a specific antigen is introduced to the body, which is stimulating the production of antibodies. Okay, and then like we mentioned earlier, this can take a few weeks to occur from your primary response, but then your memory cells can remember this and then defend upon it for, you know, many, many years. Okay? Versus passive immunity, okay? So passive immunity is going to occur when the antibodies are transferred from one person to another. Okay? So again, we have two types here. We have passive natural immunity and passive artificial immunity. So passive natural immunity is going to occur when this is transferred from a mother to their fetus. Okay? Versus passive artificial immunity is going to result from the actual injection of the antibodies. Okay? So with your passive artificial immunity specifically, this usually has more immediate effects, but it is often more temporary in comparison to the other types. Because here you're not, since you haven't gone through that typical immune response, you're not getting that activation of your memory cells to continue to defend against this moving forward. Okay, so with all of that in mind, that brings us to our immunizations, okay? So your actual vaccinations that you guys get are important in order to help reduce the occurrence of these infectious diseases, okay? Of course, these are gonna be related specifically to the recommendations from the CDC. But the big examples of these, where your actual infectious disease has declined as a result of the immunizations, are gonna be polio, measles, and smallpox, okay? Underneath that, we have a toxoid. So this is basically an altered or a weakened bacterial toxin that acts as an antigen, okay? And then we also, I know you guys have heard the term booster, okay? So this is going to be an additional immunization that's typically given about 5 to 10 years after the initial immunization. And that, again, is just helping to remind the immune system about any particular agent and help to promote that better memory response and activation of the defense system. Okay? And then we talked again about this earlier, but when we have these recurrent vaccinations that we have to go through, the flu, potentially COVID as we get more into this, that's occurring because these diseases are mutating. Okay, so it's not just the same thing that's coming and attacking you guys, just like, you know, if you think about your memory cells, that can't defend against it because it's different than it was the time before. Does that make sense? So that's why you have to constantly get the new vaccination against those types of infections. In terms of your diagnostic test for immune function, this can be used to measure your serum immunoglobulins and look at the certain antibodies that you guys have, okay? So identifying the antibodies can help detect all different types of conditions and then help to basically determine your disease states, okay? A slight change in direction here, but also related to the importance of the immune system, are your transplant types, okay? So again, we will talk more about this once we get to orthopedics, because we'll talk about different types of grafts specific to the different orthopedic conditions that you guys will see. But for now, again, I just want you to learn the terminology. So we have several different types of grafts, okay? So you have an allograft. Basically, an allograft is going to be some type of graft between one human that is then transplanted to another human, okay? An isograft occurs between identical twins. An autograft is your own tissue, so this is coming from yourself, okay? Whether it's, you know, skin from another area, whether it's a tendon that's gonna be turned into a ligament, whatever it is, it's coming from your own body, okay? Because of that, that is going to be the best option if possible, okay? It is less likely to be rejected if it is coming from yourself, okay? And then a xenograft would be a graft that is from a non-human, so we have a different type of species. Okay, the most common type that you'll see are pig grafts, okay? So these can be used for all different types of things. It could be used for skin after a burn. It could be used for ACL reconstruction. So all different types of conditions. But the important whole takeaway from this is that these things can be rejected due to your immune system response, okay? So there are actually 3 types of rejections when it comes to transplant tissue. So you have a hyperacute rejection, which means that this would occur immediately after the transplant, okay? Usually your pre-existing antibodies are present, the blood vessels are affected, and there's going to be basically an immediate lack of blood flow to this transplanted tissue, okay? There's also an acute rejection. So this is going to occur after several weeks, okay? Usually because the antigens are not matched. So there's going to be a reaction. And then we also have chronic or late rejection. Okay, this can occur after several months or several years. Okay, and this will occur gradually over time as the blood vessels start to degenerate. Okay. Now, in order to reduce this immune response and prevent some type of rejection of the new tissue, one technique that could be utilized is immunosuppression. Okay, so basically, this is going to be drug-induced suppression to the immune system in order to improve the body's acceptance of this foreign material. Okay, as you can imagine, this has to be very carefully done and carefully monitored because, of course, now you're introducing a higher risk for infection because you are intentionally suppressing the immune system. So it has to be done with caution. With that, there's going to be an increased likelihood of opportunistic infections to occur. Right? Okay, that brings us to autoimmune disorders. Okay, so basically we have a few pathologies that we're going to go through, and we're almost there. Okay, so autoimmune disorders. So when a patient develops antibodies to his or own cells or cellular material, the antibodies can then go through and attack the own body tissue. Okay, this is what an autoimmune disorder is. So basically, your term autoantibodies refers to antibodies that form against self-antigens. Okay? If you look in your book, there is table 8.5 that has a huge list of the specific autoimmune disorders. Okay, so this is going to include conditions such as ankylosing spondylitis, celiac disease, Crohn's, type 1 diabetes, Guillain-Barré, MS, RA, a ton of different things. Okay, and then here is a list of your hematotopaic disorders. So these are basically your blood or blood-forming disorders. Okay, so more things like anemia, neutropenia, neutrophilia, etc. Okay, so we're going to talk through several of these a little bit more specifically. Okay, so these are things that you are likely to actually see once you get into clinical practice. Okay, so first starting with collagen disease. Okay, so collagen is going to be your main component of connective tissue, and that's going to be found in all body structure. Okay, this is going to make up about 30% of your body's total protein. So typical diseases that are associated with collagen disorders include lupus, scleroderma, rheumatoid arthritis, and polymyositis. So lupus is a very common one that you guys are going to see. This is severe because it affects many different body systems. Okay, it causes a very characteristic butterfly-shaped rash on the face. Okay, this is, it's called lupus because of the shape of it. Lupus is wolf in Latin, and it resembles the facial markings of a wolf. Okay, this is going to involve a large number of autoantibodies against the DNA, erythrocytes, platelets, and other material. Okay, so the compromise here is going to involve the connective tissue through the entire body. So there's gonna be a lot of inflammation and necrosis. You're typically gonna see this in women, most commonly aged 20 to 40 years old. Okay? The primary mechanism behind this is immune dysregulation. Okay, so again, in terms of your signs and symptoms, you have this characteristic butterfly-shaped rash. There's gonna have a lot of joint inflammation, and it can always progress in severity toward the lungs or the kidneys. Okay, this can be really obvious when somebody comes in with the face rash, but it can also be difficult to diagnose if that component is not necessarily present and they're just having really severe, joint inflammation and pain. Okay, so an actual diagnosis is made when they have a minimum of 4 different areas of disease involvement. Okay, typically this is going to be treated with prednisone. That will help to reduce the inflammation. Okay, but no, this is not something that is curable.
Can you repeat when you said the diagnosis is made?
If there's at least 4 areas of disease involvement. Okay, we also have scleroderma. So this is also an autoimmune disorder. It's going to be characterized by really hardened, thickened, and shrunken connective tissue. Okay, this has periods of exacerbation and remission. It is progressive, but it will progress very slowly. But it can develop very rapidly at the beginning. It can affect body organs, and it can cause death due to kidney failure. Okay, so again, we have increased collagen synthesis here that will lead to sclerosis. Again, it's more common in women as compared to men. Typically, you're going to see it in middle-aged women. Okay, when you are looking at the patient, just clinical presentation-wise, their skin is going to look very thick, very shiny, and very tight. So it's going to have more of like a leather type appearance. Okay, so again, we don't have any treatment here that halts this progression. Okay, you can help to manage the symptoms through anti-inflammatories, immunosuppressives, or antibiotics. And then a lot of what we would do for this is just trying to maintain the joint mobility, the tissue flexibility as best as we could. Okay, but again, no cure, and it's progressive. All right, fibromyalgia. Okay, this is something that does not necessarily have a known cause, and it can present very differently in a lot of different people. Okay, this typically is going to affect individuals who have a lot of other things going on in their life. So like we talked about at the beginning, a lot of emotional distress, other psychological conditions, and it can present very differently in each person. So typically this is going to be very diffuse pain, very nonspecific. Treatment for this is going to be more encouragement of activities, so more aerobic exercise, stretching, just trying to help make them feel better. So you could use, some local heat depending on where in their body they're having the most pain. Stress management, a lot of education there, sufficient sleep, those types of things. This is typically chronic, but it can improve based on addressing all of these external factors. Okay, we also have immunodeficiency disorders. So this is going to be caused by a loss of function of some type of component for your immune system. Okay, this is going to lead to increased risk for infection as well as cancer. So you have 2 different types here. We have primary immunodeficiencies and secondary immunodeficiencies. So primary is going to be more genetically determined. okay? Versus secondary is going to be something that is caused by another condition. So think something like diabetes, HIV, chemo, radiation therapy, those types of things, okay? Often this is going to happen in individuals who are very ill, if they're already hospitalized, etc. So secondary immunodeficiency is much more common compared to primary, okay? And then like we said earlier, that is a big, opportunity for opportunistic infections to occur as well. Okay, so here are some examples of your immunodeficiency disorders, okay? And we're gonna talk through just a couple of these, starting with AIDS, okay? This is gonna be caused by HIV, and it is going to be a progressive impairment to the immune system. So this type of virus is going to destroy the helper T lymphocytes. It's going to cause a loss of the immune response, and then they're much more susceptible to other infections, okay? Many organ systems are going to be affected by the presence of AIDS, and this is usually going to lead to death, okay? This is chronic. It develops over a long period, or a long latent period, that is caused after an initial active infection, okay? So when you talk about HIV is the actual presence of the active virus, okay? But they might not have clinical signs of it at that point, okay? Once the infection becomes active, that's when it's described as AIDS, okay? So there are 3 big stages for HIV. We have the asymptomatic stage, early symptomatic, and advanced. So during asymptomatic, just as the name implies, there are basically no symptoms here, okay? They might develop something really light that looks more like mono or more a virus type syndrome. Typically, this is going to occur within 1 to 2 weeks of exposure, okay? And then this is going to be followed by a latency period, okay? This could be up to 10 years, okay? It could be a really long time where they feel completely normal, they have normal life, basically they're unaffected in this stage. Then we have the early symptomatic stage, where there's gonna be a lot more malaise and fatigue, okay? So your symptoms are becoming more prominent here, okay? They could have diarrhea, fatigue, night sweats, fever, weight loss, neurologic symptoms, all different kinds of things here, okay? But fatigue is really the big thing that will start to affect these individuals. Once it becomes advanced, this is when it gets really severe, okay? It's going to attack the nervous systems, okay, all of them. They could have encephalopathy, which would lead to dementia, incontinence, paraplegia, all different types of symptoms here, okay? And then like we said, ultimately, this is going to be a fatal condition that has progressed over time. HIV is a retrovirus, meaning that it contains RNA. Like we said, it develops very slowly. The time from infection of HIV to death on average is about 10 years, okay? Currently, there is no cure or effective vaccination for this condition. In terms of transmission, this is gonna be spread through direct contact, usually with blood or semen from an infected person, okay? Infected females can also transmit it to their infants, okay? As well as sharing needles with IV users. Okay, we also have chronic fatigue syndrome, okay? This is going to be basically long-term fatigue that is very disabling, okay? This is not going to have associated muscle weakness though. So this could be linked to viral infections, where there's some type of immune system compromise. This is, well, I won't say this. A lot of people believe this is more a psychological condition, but there is nothing scientifically to truly back it up at this point, okay? Similar to fibromyalgia, okay? But usually this is going to begin very abruptly, typically after some other type of condition, usually a viral-borne illness. Okay? Again, your primary symptom is going to be fatigue. Usually it lasts for 6 months or more. In terms of treatment, you want to use non-sedating antidepressants, dietary supplements, vitamins, making sure they get everything that they need on a daily basis in terms of nutrients, and then typically this is something that will just improve over time. Okay, lastly, we have your hypersensitivity reactions. So we have 4 different types, and then we're gonna go through these one by one. So type 1 being allergic reactions. So this can result in hay fever, skin rashes, anaphylaxis, or vomiting. Allergies are typically inherited. So you have your common food allergies, you know, things like nuts, shellfish, those are gonna be your really common ones. You can also have drug hypersensitivities. So you'll see it a lot with penicillin, aspirin, or local anesthetics. I'm not gonna dive into all the pathology here since we don't have time, but just make sure you know your different types here, okay? Anaphylaxis is going to be a severe life-threatening systemic condition, okay? Basically, you're getting airway obstruction here. There's gonna be decreased blood pressure and severe hypoxia. This can happen very quickly, within minutes of exposure to whatever it is that has caused this, okay? There's going to be a large amount of histamine that's released into systemic circulation. There's going to be systemic vasodilation, and like I said, severe decrease in blood pressure. Okay? This needs to be treated immediately. Okay, this is where, you know, EpiPens come in handy. If you know that this is something that you have potential to develop. Okay, type 2 is going to be cytotoxic hypersensitivity. So this is going to occur due to an antigen that is present on a cell membrane, which may be normal or a foreign component, okay? You typically see these very commonly with incompatible blood transfusions. Okay, if you get the wrong type of blood, this can happen very quickly. Type 3 is immune complex hypersensitivity, okay? So this is going to be an antigen combining with an antibody to form a complex that is then deposited into the tissue, okay? This inflammation and tissue destruction can result from this, okay? So again, your common examples here that you guys are gonna see most commonly is rheumatoid arthritis. Last one here is cell-mediated or delayed hypersensitivity, okay? So this is in reference to the antigens, okay, from the sensitized T lymphocytes. So here, your chemical mediators that we discussed are going to be released. It's going to cause an inflammatory response and destruction of the antigen. Okay, this is the type of reaction that is used when, as an example, when you're testing for tuberculosis, okay? You're gonna get a contact dermatitis as a result. So when you go to the doctor, they inject it into you, you have to go back so they can look at your skin reaction. That is an example of type 4, okay? Other examples could be a reaction to latex, like if somebody has a latex allergy, that's something very commonly that can occur here, as well as an organ transplant rejection, okay? We made it. Whew, what a morning, huh? Everyone's feeling super excited about pathology right now.
Yeah.
Okay, I know that was a lot of information, so take a little time off before you go back and review it today. Sound good? As reminders, make sure if you're on the chore list this week, you do your chores. Lab is early tomorrow, and tomorrow's class will be more fun.